I really liked your recent comments on immunity. The president, of course, is trotting out his version of immunity. Even his supporters agree he's doing it with good spirit, but little expertise. Is there any identified immunity out of this terrible virus?
Well, we do know that when people recover, they generally are impervious to reinfection for a period of several months. And we know that there's been a few reinfections, but that's not really the normal course. So I do think that for probably several months, at least, the president is not going to be able to be reinfected. So he likely will get immunity like many people do after they recover from the infection. The question is that his supporters and the people that go to his political rallies, they are not immune, so they still have to be very mindful of other people in the crowd that could be harboring the virus.
Amesh, one thing that I'm still, unclear about, can you still transmit? So even if you have antibodies, can you still be a conduit if someone's infected for you to give it to someone else?
No. After a period of about 10 days, if you had a mild or moderate case, you likely have developed some levels of antibodies, although in the president's case, he has what are synthetic antibodies because he received the Regeneron product. But you're not somebody that's considered contagious to others. So there's a difference between contagiousness and immunity. Immunity is your ability to not be infected. Contagiousness is your ability to spread to others. And at this point, the president likely has some level of immunity and is no longer contagious to other individuals.
The president had a cocktail of course, medication that is not used by many people in the world. What have we learned about the efficiency of those?
Well, the part of the cocktail that's not standard of care is the Regeneron monoclonal antibody. This is something that is in clinical trials, and we're starting to hear some data about promising results that are coming out, that this decreases symptoms, it decreases the amount of virus in your body. And the president seems to think that it worked really well for him. And obviously, we can't make a generalization based on the use in one patient. But the clinical trial data that we're seeing trickle out does look good. And Regeneron has submitted for an emergency use authorization to the FDA based on their clinical trial data. So I do think that is all starting to come out. And we are looking at it as a promising treatment that might be a bridge that we use before we have a vaccine. Because if it is something that can keep people from getting severely ill, that will take a lot of pressure off of hospitals and ICUs, and it will be something that will change the risk perception of the disease if we have something that works in this manner, because dexamethasone is more for patients who require oxygen, so they're already a little bit sick, and remdesivir doesn't have any effect or impact on mortality. It decreases your length of stay in the hospital. So if we have something that can prevent you from ever getting severely ill, that would be a really a major advance.
Dr. Adalja, J&J, Johnson & Johnson, halted, of course, his COVID-19 vaccine trial after one of the patients became ill, and they still can't explain it. It's early days, but how quickly are you expecting this trial to resume?
It's hard to say because we don't know exactly what happened with the J&J vaccine, but it's important to remember that clinical trial holds are very common, that this is just a pause to understand what happened, and it doesn't necessarily reflect whether or not the J&J vaccine will move forward or not. It's just that because even though this happens all the time, no one watches vaccines the way they're watching them now, so you're keeping track of all of these, and in normal times people are not looking. So we have to see. J&J's vaccine uses a different approach, uses a common cold type of virus that they've engineered to carry the protein from the coronavirus, and it is something that they've already used in their Ebola vaccine that is approved in the EU. So it is a technology that's already been seen. So it will be interesting to see exactly what went on in this patient. But remember, many of these trials, many of these adverse events that occur that cause pauses aren't necessarily related to the vaccine. And it just takes a minute or two to look through this patient's history and decide whether or not this was something that was happening anyway, or just coincidental to the vaccine, or was truly related to the vaccine. And we have a lot of safety data on this type of technology from the EU approval of their Ebola vaccine in the past.